Hi everyone, as promised, we are going to film a brief video on pellet placement. About a week ago, I posted a video on hormone pellet therapy. How we determine the dose for patients is something that we do on a patient-by-patient basis, depending on their labs and their symptoms, and I can talk more about that at another time, but I just wanted to show people the actual procedure itself. So our patient is already draped and prepped, and what we did was we selected a location. This is her upper hip bone right here under my fingers. So this is her upper buttock region. And so we just made a mark here and then cleaned the area with some sterilization solution. And then we have a sterile drape over the top. And now we're gonna go ahead and just make a little wheel of numbing medication that we call lidocaine here at the base of that V. Doing okay, Lynn? Mm-hmm. You can feel a poke and a burn, okay? Poke. And when we're doing female pellets, the area that we select is fairly small like this. When we're doing male pellets, the area is significantly larger, probably 3 times the size, just because the dose of male hormone is significantly larger than it is for females, and their pellet sizes are significantly larger as well. But I'll show you the size of that pellet in just a minute so you can see it. So this patient is getting a 100 milligram testosterone pellet, and you can see it's about the size of a grain of rice. And we're just going to test that area to make sure that it's numbed up. Anything sharp here, Lynn? Mm-mm. Nothing? Okay, gonna feel some pressure. So just make a tiny stab wound, that's about 3 millimeters. And then we take a sterile trocar that has a sharp end on it in order to find the spot for that pellet. And this just goes underneath the skin. Lots of pressure, Lynn. Are you doing okay? Mm-hmm. And then that pellet just gets put in this empty track here. And we advance it underneath the skin with a blunt end, like this. So then that pellet ends up being about 1 inch or so away from that incision. And that's about it. I'm just going to take some steri strips. I'm going to pull this off. We'll just close this with just some tape. It doesn't even need a stitch. The wound is so tiny. We like these steri strips to stay on for 3 to 5 days. And then that wound just comes together all on its own. And then my nurse, who is filming, typically cuts some tape for me, but can't. But we'll just dress this with some really sticky tape that stays on for at least the next 24 hours. We tell patients no showering today, but that they can shower tomorrow. But again, those steri strips stay on for 3 to 5 days. We have patients come back in approximately 6 weeks and we recheck labs. And how the numbers look and how their symptoms are controlled determines how we make adjustments for pellets in the future. But that's it. Thanks so much for watching.